Let's talk through how a note is actually delivered out of the system. This is a very complicated workflow, but I think once you understand it, it'll help you in note routing. So, first, I want to highlight for you the interplay between the relationship you have with the patient, the encounter that you're in, and the note that you're selecting. All these three things dictate whether a note goes out in automated fashion to the system and to who. The relationship with the patient is first. You can establish this either by yourself as you enter into the chart, you've gotten that pop up before, or it's established at registration. And there's a couple key relationships that receive notes. This would be the primary care provider, the attending, the referring, and the consulting provider. Once you have that relationship set and you're in a encounter type set to receive notes, which I would say is most of them in the domain, that is your ER, your inpatient, your ambulatory, your recurring, etc. You will then receive all the notes set to go outbound, and this would be your admission H&P notes, your consult notes, your discharge summaries, your operative notes. All those things are automated and will automatically go. Now, if you are needing a note and you haven't set up one of these relationships, or you need to send up to someone who is also involved but doesn't have a relationship set up as described, when you sign your documentation, you'll have an opportunity to add that individual. This will work for people who have an internal message center, basically anyone who's built as part of the domain. They'll get that note routed via their message center, and also if they have an external office tagged to their either fax or HRM workflow. If they don't, you have two options. You can do something called the medical request workflow or medical record request workflow, where you'll have your document that you'd like and you hit print on the top right. There you can then fax out to the person, and we've got a whole dictionary of people built into the domain. Or you can ad hoc fax it by hitting underscore ad hoc fax and not putting any ones or dashes in there. And then you get a little pop-up. I'll say it's pending, and then you'll see that it's gone outbound. The other workflow that you can use here is something called the provider letter, where basically instead of just sending that fax, you send it with a face sheet as well. And you can, on this face sheet, basically provide a description of why you're sending that note to them, what you're asking them to follow, etc. And also you can attach more than one note. So you can send multiple notes under this strategy, which is really good if you have a bit more of a complex workflow or a specific request that you're making for someone on the other side. So these are all the ways that you can send notes outbound in the system. It's something that we continue to work on. There's multiple third parties that we need to send to, either fax, HRM, Clinical Connect, the acute and community care repository, and in the future looking towards the HIE as well, the Health Interoperability Exchange, which helps share notes between systems.